Hi, I'm Brittany Green. I'm going to be doing an assessment on Stacy, who is 18 and has consented to the video. I'm going to be doing an assessment of her head, neck, face, lymph, respiratory, and cardiac systems. First, I'm going to start out. I'm just going to check her head and neck for any tender spots. So I'm going to check different, sinus cavities. Are you feeling any tenderness anywhere that I push? Check around the base of the skull. Check around the collarbone. I'm going to check her thyroid, make sure she doesn't have any swelling or nodules. I'm going to check to make sure that her trachea is midline, which hers is. Make sure there's no deviation to one side or the other. Next, I'm going to move down to her chest. I'm going to, if we're in the clinical setting, I would check and make sure there's no broken areas or lesions on the skin anywhere. Back up to the neck, I'd also check to make sure she doesn't have any jugular vein distension on either side. Everything looks good. So I'll move down to the chest. First, I'm just going to take a listen over her heart tones. You can hear S1 and S2 sounds. And then I'll just go ahead and take a deep breath in and out. Listen over all the lung fields. Everything's nice and clear. I can check for tactile fremitus by taking the side of my hand, placing it over the different places on Stacy's back, and asking her to say 99.
99, 99.
And I can feel the vibration through my hand over the lung fields. When I get down past the lung base, I'm not feeling any vibration there anymore. And that just kind of, if you've got an effusion or something like that going on, you're not going to feel that vibration over where the lungs collapsed. You can also do percussion to check for lung expansion or to check to see where the margins are of the lungs. And that can tell you if you've got an area that's collapsed. I'm also going to check for lung expansion. I can just put my palms on either side of her chest, and Stacy, take a big deep breath, and just make sure that my hands are moving evenly out and back in. I can also check for tenderness at the CVA. Do you feel any tenderness here? Just check over top of the kidneys, make sure there's no tenderness going on there. And actually, first and foremost, I would, before I started my assessment, ask my patient, how is your breathing?
I'm fine.
You're fine,
No
not having any short of breath? How about when you're getting up, doing things around the house, getting dressed, cooking dinner? Do you get short of breath?
No.
No? How about walking upstairs? No? Okay. And are you feeling any heart palpitations? Feel like your heart's skipping a beat, or your heart's racing, or anything like that? No. Having any swelling anywhere? Doesn't look like she's having any swelling. So, first and foremost, I always ask my patients what kind of symptoms they're having. So, also going back to when I was listening for heart tones, I'm also going to make sure that I'm listening for and noting any murmurs, clicks, gallops, anything out of the norm, and make sure that I note that and make sure the physician is aware of anything like that going on. And this concludes my assessment. Thank you.